Hey everyone, welcome to part 2 of our segment Coding with Miss Melanie, Coding Clinic and Coding Review section. Today we're talking about our first coding clinic and some of the questions that were brought up during Learning Module 1 and into Module 2 in our class for 2030. So this week, our biggest focus that I've had questions so far on is modifiers. Now, modifiers can be very scary and don't let that discourage you. One thing that I've heard from several students so far is, I understand all the coding pieces so far except those modifiers, and man, I hate them. Well, most coders feel the same way you do. For this reason, there's a lot of information about modifiers out there, and our goal today is to talk about some of those, but not all of them. If you look at all of your modifiers, they can get overwhelming. Right now, we're going to take them piece by piece, and each week you'll notice in the instructor folder a section that talks about the modifier tip for the week. So one thing I like to do with my modifiers is to flip into the back under Appendix A. I know that's reversed in the video, so just keep in mind Appendix A is where you're going to find in your CPT all of the details on your modifiers and further descriptions. In the very front of your CPT book, you have kind of like an abbreviated modifiers that are common, but not all of them are there, and the descriptions with the rules on them are not there. So it's really important as you're learning modifiers to refer to Appendix A for all of your modifier questions, and if you're in a hurry, such as an exam, make sure to reference the modifiers in the front and be comfortable with what each of those are. So today we're going to talk about modifier 25, 51, 59, and X-modifiers. I'll just kind of tell you there's a video on X-modifiers in Module 2's instructor folder, and so we'll wait until next week to talk about those, but they kind of go alongside of 59. We'll talk about 52 versus 53 and 26 versus TC. Okay, so if you really think about it, there's a couple of different types here. So we're really just looking at 3 categories of modifiers. Our first one is modifiers that say this is something separate of what else is being done. Now, one of the rules with CPT coding is that in most cases, if there's more than one code, unless it's an add-on or modifier 51 exempt, and you'll see those with the symbols in your CPT book for add-ons and modifier 51 exempt, but unless it's one of those, you need a modifier to separate this procedure or office visit from another procedure or office visit service. When I say office visit, I'm talking about our E&Ms, which are evaluation and management, and something we'll be learning about very detailed in section 2 of this class, which starts with module 5. For now, just know that office visits exist, or E&M codes, and whenever we refer to them, they need an E&M modifier to identify them separate of other services if other services are performed. Now, there's a few other unique circumstances that we can go into detail with modifiers later on in the class, but for now, I want to talk about modifier 25 and 51 or 59, which are your procedure modifiers. In our Appendix A, the code description for 25, significant, separately identifiable evaluation and management service by the same provider or other qualified healthcare professional on the same day of the procedure or other service. So let's listen to that again. Significant, that means unique, stands alone. Separately identifiable, not part of other things that are being done. Evaluation and management service, meaning it has to be appended to an E&M code such as 99213. That's one of your office visits for an outpatient established visit. Okay. Done by the same physician or other qualified healthcare professional. That simply means that either the same doctor or someone within his office. On the same day of the procedure or other service. So on the same day as another service such as 17110, which is destruction of a benign lesion with cryotherapy. I always say that one a little off. Okay, So let's look at these two. By the way, you may notice that this is similar to one that's in your exam. Yay! Okay, so question is, if we have two codes and they're not modifier 51 exempt or an add-on, do we need a modifier? The answer is add a modifier. Yes, add modifier. Okay, so two codes, not with those symbols, then yes, add a modifier. Okay, so both of these codes, if you look up 99213 and 17110 in your CPT book, neither of those have a plus symbol or a 0 with a dash through it. So neither of them are add-ons nor modifier 51 exempt. The question is, do we add a modifier to the office visit then, or to the procedure, or are both services actually supported? So we're presuming this week that it is supported. 99213 is separately identifiable from an example where a lesion's done if the office visit is done for a reason other than a lesion removal. So let's say you break your leg, and while you're there you get a lesion chirotherapy off. That's separate. It's not related to a lesion, so it is separately identifiable. If you're getting seen for hypertension and diabetes and hyperlipidemia, which are 3 chronic conditions commonly reviewed, those would be considered separate from a procedure to burn off a lesion. Pretty much anything that's not talking about burning off lesions would be separately identifiable so long as it's properly documented. So for those reasons, we need a modifier. Now, you're probably already thinking she wants us to add modifier 25. You'd be right. But let's look, because it's always important to look at everything available to you. And I can't stress that enough. I know that I'm kind of leading you guys into saying, yes, let's add modifier 25, but I want you to understand when to add that and why, and how to know that nothing else applies. So if I was looking at this as a new coder, I might say, well, how would I know 25 over 51 or 59? Why wouldn't I put that on the procedure? Because the definition for 59 and 51, now 51 says multiple procedures. So the question is, there's multiple codes, are they multiple procedure codes? And the answer to that is no. This is one procedure, this is an E&M. We can identify that by looking at both codes in our CPT manual. So a 51 would not apply here. But what a 59? What does 59 stand for? Distinct procedural service. Let's think about the word distinct for a moment. Distinct is very similar to the word separately identifiable, or the phrase, or the word significant. In fact, it more or less means the same thing. It's standalone, it is distinct. You can identify it separate, so it is a distinct or separately identifiable procedure. However, if you look at the full description here, Modifier 59 in the Appendix A states, distinct procedural service under certain circumstances. It may be necessary to indicate that a procedure or service was distinct and independent from the other non-E&M service performed on the same day. So I'm just going to stop right there. We use 59 on a procedure only if that procedure is distinct and independent from other non-E&M or other procedures. So it can't be against 99213. For that reason, when you say which modifier do I add, when I'm comparing modifiers 25, 51, and 59, or X-modifiers, the answer to that is if you have an office visit on the same day as a procedure that is not an add-on or a modifier 51 exempt, it's going to be a modifier to 99213. And the way you want to write that is 99213-25. Okay, so for our second modifier that we're looking at, the difference between 52 and 53, reduced and discontinued services. These are two completely separate descriptions here, and what you want to do is you want to read through that and see what are we talking about when we say reduced and what are we talking about when we say discontinued. Okay, so there's a couple of guidelines and you can read the full description in your Appendix A for reduced and discontinued services. For now, let's look at reduced services for modifier 52. Now you'll notice first of all that this is going to be a modifier that is used for a procedure, not on an office visit. And the reason why is, well, an office visit is simply an office visit. We're talking about reduced services for procedures. So when we talk about this, a reduced service is talking about payment. So 52 and 53 both equal less pay. So when we're submitting this for billing purposes, we're saying that something was less than what the full charge is of that service. And so both of them seem like they're saying it's less than the full procedure. For example, we did discuss, and I don't have it in this book, but your HCPCS book would have a PAP collection charge. And one of the descriptions we had for a discontinued or reduced service was if a patient comes in to obtain a PAP and before the PAP is started, they notice that the patient is bleeding on her period and cannot have the service performed. Do we charge the 52 or 53? The answer is no. The service was not started. There were no charges. There was nothing incurred by our office for having the plan of doing a procedure except our time. And so we don't need to bill for a service to get partial payment because no service was partially done. We would instead bill an office visit or an E&M service if no procedure. And this, of course, falls under only if it's documented for an appropriate E&M service, which we can most likely find within documentation of that visit. Now, let's talk about when we would use 52. 52 is for reduced services. This means that whatever the procedure that you're doing, the code description has more to it than what was actually done. So how do we know what was actually done has to be included? Well, anytime you see the word and represents and or. So if it's an and or, it does not have to be included. However, with, when you're talking about the word with, this has to be included in the code description. So if you have a code that is with something and it is not documented as performed and there is not another code that describes what was done without, then you will have to, unless it's with or without, you will have to append modifier 52. Now in the real world, this is very rare and not common for you to do. And most coders will find something that seems like it would be reduced and they'll scour through the code book to see if there's anything else that might describe the code. And sometimes an unlisted code is actually better than the charge we were going to list as reduced. So for example, let's say we have a patient that comes in Okay, let's say that we have a patient that comes in for dilation and curettage, diagnostic and or therapeutic, non-obstetrical. Okay, and if they had dilation but not curettage, would we charge the code, which if you want to look in your CPT code book, 58120. Now, keep in mind dilation and curettage. Your documentation states dilation only. If your patient had and curettage, remember that and means and or. So we could still use 58120 if the curettage was not performed, but the dilation and diagnostic and or therapeutic portion of the service was. So would we use a modifier 52? No. That example says that the word and indicates and or. Now in your exam, I've given you a code that has a with. I want you to pay attention to that. If you haven't taken the exam already, you can go ahead and keep that in mind. If you have, go ahead and look at that because you'll notice that the term with means that you have to have that coded. Okay, we're running short on time, so let's go ahead and look at our last code section here for modifiers, which is modifiers 26 and TC. Okay. Modifiers 26 and TC, this one's going to be a brief review, and this will be something we're going to come back to when we go over our learning module for radiology and laboratory services. So for now, let's talk about what is 26 and what is TC. Okay, let me erase this here. A 26 modifier is a modifier appended for professional services, whereas a TC modifier is a modifier indicated for technical services. Now, not to be confused with the fact that this is all professional-based billing. So you have 26 is professional component. And this includes interpretation and report that would be done if you were in a doctor's office and they're looking at an x-ray or a lab. They're interpreting those x-rays and labs, and they're making a report or an assessment of what is being shown in that result of that test. This can also be performed or added to an EKG, which you'll notice are in the medicine section discussed in Learning Module 2. Our TC is our technical component. And I always like to say that technically we collected it. Technically means, again, kind of like facility-based components. Technical is talking about the technician's time. They went in, they had a lab drawn, or they had an x-ray collected. It was not read, instead it was sent off. So technically they performed the x-ray, but they did not provide the professional services. Now, when would neither be used, or what if both pieces were done? Then you would only list the charge that includes both services. So there's a lot of different examples. One thing we'll talk about in medicine section is our EKGs. And EKGs are 93, I want to say, 000, 93005, and 93010. Let's see if I'm right on that. I'm flipping to it in my CPT here with you, ladies and gents, boys and girls. And you know, it's always when you're trying to flip through something that you can't find it. There we go. So 93000 versus 93005 and 93010. Okay? The differences between these. 93000 is a full EKG, or ECG, if you will, depending on how you spell cardiovascular. 93000 includes both the professional and the technical components. 93005 reads tracing only without interpretation and report. That is a technical service. And 93010 reads interpretation and report only, which is your professional service. So that can get a little confusing because there are codes like EKGs or ECGs which include breakdowns. So one of your jobs as a coder is to determine, is there a code that gives me all the components that I need, or do I need to modify the code description by indicating a modifier? So that's it for our segment today. This was Coding with Miss Melanie, our first segment for Coding Clinic Review. Go ahead and tune in next time, and we'll see you then.